Next up, we have the student group from physical therapy. That's right. Welcome to the stage.
Hi, everyone. My name is Jess.
My name's Olivia.
I'm Andrew.
And I'm Carly. And for our capstone research project, we assessed and evaluated health and wellness, education, and accredited PTA programs in the United States.
So as healthcare professionals, physical therapists, and physical therapy assistants have a responsibility to guide patients' behavior, to promote lifestyle strategies for risk factor reduction, and prevention of unwanted diseases and illnesses. These diseases could include cardiovascular disease, obesity, type 2 diabetes, and mental health illnesses and cancer. According to RIP, these lifestyle strategies include regular physical activity, weight management, proper nutrition, smoking cessation, stress reduction, and mental health. These lifestyle strategies have been shown to have a positive correlation with decreasing cardiovascular disease, cancer, and mental illnesses such as anxiety and depression. According to Mccann, the leading cause of mortality within the United States are modifiable behaviors and lifestyle choices. The foundation of health promotion, education for physical therapist assistants, is centered around the concept of a therapeutic alliance, referring to the partnership between clients and their practitioners. Studies by Haynes have shown that this therapeutic alliance creates a positive correlation to improve treatment outcomes related to pain, disability, physical and mental health, and satisfaction with treatment. The American Physical Therapy Association, the ATPA, outlines the critical role physical therapists and physical therapist assistants play in the promotion of health and wellness and the effectiveness of them as health counselors.
So while we were looking for similar studies to our own, we found that there was limited research that exists on the health and wellness education in PTA programs. However, we were able to find some studies that looked at the PT education. Dunleavy et al. Examined how population health is included in PT education, and the key findings were that 72% of the programs include population health topics, but only 38% have dedicated courses. The faculty face barriers like time and resources, but most believe that this topic is essential. Black et al. Studied patient perspectives on PT involvement in wellness topics. The key findings were that most patients agree that PTs should discuss these wellness topics and act as role models for wellness. And many patients have not had these discussions with their PTs, but they're open to it. Jewell et al. Examined the practices and educational trends among PTAs. The key findings were 65% of PTAs engage in continuing education, 40% of PTAs desire advanced certifications, and 55% of PTAs face time constraints as a barrier. Overall, the PTA field is evolving, and standardized education is required to address changing educational needs. Okay, so the aims of our study were to assess and evaluate the accredited PTA programs in the U.S. regarding health and wellness topics within the curriculum, inclusion of teaching methods of how to monitor a patient's readiness to change lifestyle behaviors, extent and quantity of class and lab time dedicated to the health and wellness content and lifestyle behavior coaching techniques, any changes to health and wellness after COVID-19, methods to monitor student knowledge of health and wellness topics, incorporation of outcome measurements to assess students' use of health and wellness in their clinical experiences, and any barriers that prevent PTA programs in providing the knowledge on these topics of health and wellness.
So our study utilized a quantitative cross-sectional survey design in order to explore how wellness education is integrated into PTA curriculum across the United States. Now, this was framed from the lens of prospective physical therapists such as ourselves, as well as faculty and directors from PTA and PTA and DPT programs. Now, our target was all 359 US accredited PTA programs according to the CAPD, the Commission of Accreditation for PT Education. And this is where our contact information for each program was sourced from. Now, we included all 359 programs that were accredited into our sample population, and we excluded all programs that were not accredited, were pending accreditation, or international programs. And this was to ensure that our measures of education were consistent. Now, the survey was a 20-item questionnaire that was developed from published benchmarks and also expert guidance, and in order to explore health and wellness domains such as physical activity, nutrition and sleep, stress, substance use, and more, all of which are directly related to chronic disease prevention and holistic care. Now, in order to ensure face validity, this was reviewed by 5 external PTA program chairs. So as far as how our survey was administered, it was through the platform Qualtrics with an anonymous link that was sent out to each program chair. The distribution window opened on February 11th, and this also included 2 email follow-ups and also phone calls to maximize participation. The estimated time to complete our survey was 5 to 10 minutes, so this was extremely accessible and efficient. The questionnaire format included Likert scales, multiple choice questions, and also short answers. We collected data about the academic role of each program chair or faculty, the program location and setting, time allotted towards the health and wellness topics, and also instructional format. Next steps for our study will include descriptive statistics in order to evaluate overall trends in program responses and also wellness education across the PTA program and curriculum landscape.
So within our research, we had a response rate of 37% with a total of 135 participating PTA programs. Of those 135, 31% were located in the Midwest, 28% were located in the South, 22% were located in the Northeast, and 19% were located in the West. A total of 89% of the respondents stated that they agreed or strongly agreed with the fact that their program encourages students to educate patients and clients and the community on lifestyle and behavioral changes to promote wellness under the direction of a PT to their future patients. When evaluating how programs provide the knowledge to do so, 73% of the respondents indicated that their health and wellness education was threaded throughout their program. 20% indicated that it was incorporated into a course. Only 4% reported that it was a standalone mandatory course, and 1% offered it as an elective. The remaining 2% selected other with write-in responses that included community participation and the incorporation of exercises into some lab activities. What we also wanted to examine were the curriculum changes relative to current events such as COVID-19 pandemic. Through this question, we were able to identify that yes, some PTA programs did have additional health and wellness material, but an almost equal amount with only one school making the difference made no changes to their curriculum. Furthermore, we also wanted to examine whether or not program curriculums included content relating to a PTA's ability to monitor a patient's readiness to change with lifestyle changes using different methods such as the trans-theoretical model, stages of change model, and the 5 A's. And from the first statistic mentioned, 89% did indicate that their program encourages health and wellness education, but here we can see that 65% don't provide students with the ways to do so. Only 26% stated that they would do, and 9% were unsure.
So in essence, there is a growing support for PTA programs, support of wellness education, and that signals an encouraging trend towards preventative and patient-centered care. Now, over half, 54% of programs have made changes to expand curricular content relating to health and wellness education. However, a clear belief-practice gap remains. While programs value wellness education, few provide structured training in assessing patient readiness to change, and even less towards coaching techniques. Now, this disconnect tells us that although the intention is there, implementation has not fully caught up. This gap may limit PTAs in effectively delivering holistic and wellness-oriented care.
So possible limitations in our study, programs that do not incorporate health and wellness education into their programs may not have been likely to fill out the survey, as well as the opposite of those who are interested in it and have a familiarity with it may have been more willing to participate in the survey. There also is a risk for selection bias, so faculty members teaching health and wellness may have been more inclined to report with positive feelings, or such that program directors may have been unaware of how in-depth they were going in their coursework. So to conclude, with growing curriculum inclusions, PTAs are increasingly positioned to support holistic, patient-centered care, they play a meaningful role in preventative health strategies, and drive positive behavior change through evidence-based communication tools. Further research should examine how expanded wellness education affects PTA students' competency, communication, clinical confidence during both clinical internships and early practice. We also wanted to take a moment to thank Dr. Ahearn for all of her guidance and support with this project. Thank you.
Okay, awesome.